Hi everybody, in this video we are going to continue about the study of non-communicable diseases. We are going to continue about the study of non-communicable diseases. So here we are going to discuss about the cardiovascular diseases. Cardiovascular diseases. As we all know, the word itself tells us that it is regarding with the circulatory system. It is regarding with the circulatory system, mainly involving the heart and the blood vessels. Heart and the blood vessels. Or otherwise here, cardiovascular diseases are those diseases which will not spread from one person to another person. And these diseases, cardiovascular disease, that's why they are called as what? Non-communicable diseases. So here in this video we are going to discuss about the cardiovascular diseases. Cardiovascular diseases affect blood vessels and the heart. So whenever there is a damage, that is created to the blood vessels and the heart, we can say that they will be coming under what? Cardiovascular diseases. So cardiovascular diseases will affect mainly what? The blood vessels and the heart. Blood vessels and the heart. So in this we are going to discuss now types of these cardiovascular diseases. They can be broadly classified into various types, and in this video we are going to discuss about those different types of cardiovascular diseases which are affecting the blood vessels and the heart. Now the first type, which is very common in most of the people, that is hypertensive heart diseases. Hypertensive heart disease. So let us say that this as the hypertensive heart diseases. So here, what are those which comes under the hypertensive heart diseases? Now the first one is, as we should keep it as in our mind, as atherosclerosis. Atherosclerosis means what? It is a hardening and loss of elasticity of the arteries. As we all know that if you are looking at the blood vessels, especially the arteries, we know that these arteries will be carrying what? The oxygenated blood. And here what happens is that when the pressure increases, the blood should be pumped through these arteries to all the body parts. So as the heart pumps the blood is rushing into the arteries to supply blood to all the cells in our body, or all the tissues and cells in our body. So when the blood is moving, because of the heart rate pressure, these blood vessels are inbuilt to undergo what? Contraction and relaxation. For pumping of blood. That is very, very important. One of the major important characteristic of what? The blood vessels. And here we are talking about what? The arteries. So arteries will be pumping the blood. They undergo contraction and relaxation. And that is very important. But here what we are saying is that elasticity is lost in some cases where the blood cannot freely move. In which cases, when there is hardening and loss of elasticity of the arteries. When there is hardening and loss of elasticity of the arteries, then it is very hard for the flow of blood. And it causes, because of the hardening and loss of elasticity, it causes hypertension. What is hypertension? Commonly we call it as BP. That is nothing but high blood pressure. It leads to high blood pressure, which is not good for an individual. So here we have to remember, because of the hardening and loss of elasticity of the arteries, it is leading to what? Hypertension. That is nothing but high blood pressure. We call it as BP. In short, we are calling it as what? It is called as BP. We are calling it as, where we know that normal blood pressure of an individual is what? 120/80 mmHg we say. But this will be more in the case of those people who are suffering with what now? Atherosclerosis, in which there will be hardening and loss of elasticity of the arteries, which we are calling it as what? Hypertension or high blood pressure. High blood pressure. And the next disease is atherosclerosis. Atherosclerosis, which is coming under what? Hypertensive heart diseases. So here, what is the main cause of atherosclerosis, or what do you mean by atherosclerosis? Atherosclerosis means, if you are taking again the artery, say suppose we are taking one artery. So here, if this is the artery, if this is the artery, it has the narrow opening for the flow of what? The blood. Okay, blood will be moving it through the narrow opening that is there. Okay, narrow pathway that is there in the arteries. But here, in case of atherosclerosis, there will be the formation of the fat deposition inside the inner walls of the arteries. Okay, inside the inner walls of the arteries, there will be fat deposition that will be taking place. Which means here, in correct sentence, let us see, lumpy thickness means thickness is increasing now in the arteries. Lumpy thickness develops on the inner walls of the arteries. On the inner walls of the arteries. Say suppose here is the outer wall. Let us say that this is the outer wall of the artery, and here is the inner wall. Okay, this is the inner wall now. Now here, let me say that this is the outer wall. Okay, and this is the outer wall, and whereas this is the inner wall. Okay, this is the inner wall we are saying. So there is lumpy thickness develops on the inner walls of the arteries we are saying. What is that which creates this lumpy thickness or thickness? It is because of the fat deposition. Okay, it is because of what? Fat deposition. There will be accumulation of fat on the inner walls of the arteries. So due to the accumulation of these fats on the inner walls of the arteries, what is happening to the passage? It becomes much more narrow. Okay, it becomes much more narrow. So the blood freely it cannot move. Okay, there will be difficulty for the movement of the blood, because what happened? The path became very narrow. The path became very narrow. Why the path became very narrow? It's because of what? Lumpy thickness. It is because of the lumpy thickness that developed in the inner walls of the arteries. What caused this lumpy thickness? This lumpy thickness is nothing but it is because of the fat or the cholesterol. Okay, slowly there will be accumulation of this fat, making the pathway of the arteries narrow, restricting the free movement of the blood, restricting the free movement of the blood. So that's why the blood cannot move freely for supplying the blood to all the parts of the body. So this can cause what? Hypertension. It is coming under as, that's why we are saying it as it is coming under as hypertensive heart diseases. So what is that happens here? It prevents the dilation of arteries. Freely the arteries cannot dilate. Okay, vasodilation will be restricted. Why? Because there is fat deposition. It prevents the dilation of the arteries. As we already said, the arteries will be enlarging. Vasodilation and vasoconstriction will be taking place. Vasodilation and vasoconstriction is very important. Okay, vasodilation and vasoconstriction. Okay, vasoconstriction is very important in the case of blood vessels. Okay, in the case of blood vessels. So here vasodilation cannot occur freely. Why? Because of the deposition of what? Lumpy thickness, maybe fats or cholesterol we say. So that's why in these vessels, okay, they become smaller in diameter. See now, the diameter reduced. So we have to remember this, the diameter reduced. Because there is, less diameter, small diameter, these blood vessels cannot fully expand. If they are expanding, the blood will move very freely. But here, due to the accumulation of the lumpy thickness or fats in the inner walls of the blood vessels, it prevents the dilation of the blood vessels, especially for arteries. Okay, arteries cannot dilate, and they become very small in diameter, and they cannot expand properly. So that's why it is called as what? Atherosclerosis. Atherosclerosis. In this, you have to mainly remember the lumpy thickness, that is nothing but fats or the cholesterol that accumulates in the walls of the blood vessels. In the walls of the blood vessels, as here I am showing here. Here, this is the fat. Here is the fat that is accumulating. Slowly it starts accumulating in the inner walls of the blood vessel. So what is happening? The path is restricted, became narrow. The path became narrow, and the blood cannot move freely because there is decrease in the diameter, and it is affecting the arteries in increasing their diameter or to expand. So that's what we have to remember. And here there is also one belief, and it is true, that those people who are identified suffering with atherosclerosis, in their diet they should take sodium very less amount. Very less amount. So dietary sodium is restricted. In those people who are suffering with hypertensive heart diseases, one point that we have to remember is that dietary sodium should be restricted. Their sodium levels should be restricted, or in other words we can say what we add in the form of salt intake should be restricted. That is another point we have to keep in mind. And now the next one is hypertension, which is also coming under hypertensive heart diseases. Hypertensive heart disease. Hypertension, as we already said, blood pressure, high blood pressure. Okay, so hypertension can be defined. Okay, hypertension can be defined as what? Resting arterial pressure exceeding more than 120 by 80 mmHg over a prolonged time. So what is hypertension? It can be defined as resting arterial pressure exceeding 120 by 80 over a prolonged time. We are calling it as hypertension. As we all know that normal blood pressure, normal blood pressure is how much? It is 120 by 80 mmHg we say. Okay, normal blood pressure is this, where 120 is what? The systole. Okay, 120 is the systole. These are the basics that we should keep in mind. And what is 80? It is the diastole. Okay, diastole. So systole means what? Contraction. Okay, contraction of the heart. Diastole means what? Relaxation. So systole means, in simple, we have to remember contraction of the heart. Okay, contraction of the heart. And diastole means what? Relaxation of the heart. Okay, relaxation of the heart. So actually, any healthy person, their normal blood pressure will be about 120 by 80. 120 by 80. And now what we are saying? Hypertension. Keeping that in mind. Now if you see hypertension, when blood pressure is increasing more than this, okay, when blood pressure is increasing more than this, we are calling it as what? Hypertension. Hypertension. And this is very, very important and very dangerous also, because here there are various disorders that we should keep in mind when we talk about the hypertension. When blood pressure increases, exceeds that more than 120 by 80, there are chances that particular person may suffer with what? Heart failure. Okay, may suffer with heart failure. And because of high blood pressure, it can also affect or damage the kidneys. Kidney damage will be taking place. Okay, kidneys will be damaged because blood is pumped very fast to the kidneys, where there will be minute blood vessels and which can rupture also. So that's why we say that kidney damage will be taking place. And at the same time, when the hypertension, when the BP is increasing, blood pressure, high blood pressure is seen, it also affects the brain. We call it as cerebrovascular accidents. Okay, cerebrovascular accidents. We are calling it as CVA, or otherwise sometimes we also call this as stroke. We also call this as stroke. Okay, we also call this as stroke. And these are the disorders that we should keep in mind that can occur due to what? Hypertension. Okay, if it is not controlled. Okay, if it is not controlled. So we have to remember this hypertension. So hypertension can be broadly classified into two types. Okay, hypertension can be broadly classified into two types. One we call it as primary and the other one is called as secondary. Primary hypertension and secondary hypertension, or otherwise essential hypertension we are calling primary hypertension also. Why we are calling, what is the meaning of this primary hypertension and secondary hypertension? When exact cause is not known, why the BP is increasing, why high blood pressure is increasing, when the exact cause is not known, okay, when the exact cause, okay, when the exact cause is not known, okay, not known, okay, we call it as what? We call it as essential or primary. So essential or primary hypertension is nothing but when the exact cause is not known, we call it as what? Primary hypertension. Primary hypertension. 90% of the hypertension is primary only. Okay, 90% of the hypertension or increase in high blood pressure is nothing but primary, we are calling it, because the exact cause for that is not known. Okay, exact cause is not known. But whereas the other 10%, okay, when we are calling it as secondary hypertension, we are calling it as secondary hypertension. When the cause is known, okay, when the cause is known, okay, we are calling it as what? Secondary hypertension. Which means we know why the hypertension is being seen in a particular individual. What is the reason behind for the increase in high blood pressure? When you identify that, we are calling it as what? Secondary hypertension. When we cannot identify why the blood pressure is raising, we call it as what? Primary hypertension. That is the clear meaning that we have to keep in mind when we are talking about the hypertension, types of hypertension. Now, 10% of this only the secondary, okay, hypertension, secondary hypertension. And why? What is that? We are saying, we highlighted here, when the cause is known. So what would be the cause for increase in hypertension? There are various reasons for this, okay, various reasons for this. Some reasons is because due to over secretion, okay, due to over secretion of some substances in the body, okay, due to over secretion, due to secretion of, like aldosterone, okay, due to secretion of aldosterone, okay, due to secretion of more aldosterone, what can we see? Secondary hypertension. Due to secretion of more epinephrine, okay, epinephrine, you can see that hypertension is seen, okay, secondary hypertension can be caused. And moreover, due to the over secretion of renin, okay, renin, there can be hypertension, secondary hypertension can be caused. So what is the cause now for increase in the hypertension? So here, due to secretion of aldosterone, epinephrine and renin, then it can lead to what? Hypertension, over secretion. Please remember, all these are very important in the body, but that should be balanced. But they are produced in more quantity, then it leads to secondary hypertension. So here, if you are saying aldosterone, from where it is produced? It is produced from the adrenal cortex, okay, it is produced from the adrenal cortex. And at the same time, if you are seeing the epinephrine, it is produced or secreted from the adrenal medulla, okay, it is produced or secreted from the adrenal medulla. And at the same time, now if you look at the renin, renin is produced from the kidneys, okay, renin is produced from the kidneys. So those are also important, from where they are secreted. So all this we have to remember, So what is the treatment for hypertension? What is the treatment for hypertension? So here there are, if you are looking at the treatment, here they administer many drugs, okay, drugs will be given, means medicines are given to inhibit the sympathetic nervous system, okay, to inhibit the sympathetic nervous system, drugs will be given. So these drugs, what they do, they inhibit the sympathetic nervous system, and in turn it will be reducing the hypertension, means there will be decrease in the hypertension because of the use of drugs which will inhibit or act upon the sympathetic nervous system. And at the same time, the other one that we have to keep it in mind is the dietary sodium, okay, dietary sodium must be restricted. Dietary sodium, okay, is restricted, means those people who are suffering with hypertension, okay, should take less amount of sodium. So in this video we discussed about what? Hypertensive heart diseases. The first disease that we studied is arteriosclerosis, okay, arteriosclerosis we studied. And the second one is what? Atherosclerosis, okay, atherosclerosis we studied. And the next one what we studied? We studied about hypertension, okay, hypertension. So here, just to recap what we studied, arteriosclerosis means what? Hardening and loss of elasticity of the blood vessels, called as what? Arteries. Arteries will become hard and lose their elasticity. That's what we have to remember. Atherosclerosis means what? Lumpy thickness in the inner walls of the arteries is called as atherosclerosis. Means what? Because of the fat deposition or cholesterol in the inner walls, the width or diameter becomes very small and the blood cannot move freely and the blood vessel cannot fully expand. That's what we studied in the atherosclerosis. Hypertension means what? When there is blood pressure increasing more than what? 120 by 80, okay? Increase more than 120 by 80 mmHg, we are calling it as what? The hypertension. And last, we studied about the treatment, okay? Last, we studied about the treatment where the drugs are given to inhibit the action of sympathetic nervous system, and dietary sodium should be taken less. So in the next video, we are going to continue about the non-communicable diseases. Thank you so much.